and welcome to our second of 3 open dialogue webinars about the National Ombudsman Reporting System, otherwise known as NORS. These webinars are specifically for those of you in the field who provide direct Ombudsman program services, and attendees today include state ombudsmen and representatives of the office, also known as local or regional ombudsmen. My name is Amity Overall Labe, and I'm the NORC Director, and our speakers today include Louise Ryan, Ombudsman Program Specialist, Administration on Aging, Administration for Community Living, and Maria Green, NORC Consultant. If you joined last month's webinar, you know that we're trying a new webinar format called an open dialogue. So today's discussion is about complaint coding, which is the part 2 of the NORS training. We'll only present a few overview slides, and then the majority of the time today is open for you to ask questions. You'll ask questions by using the chat feature or Q&A, which I'll explain in a moment, because everyone is muted. You can think of this as a drop-by event where you're not obligated to stay the entire time. Feel free to ask your question and stay on to listen to others, or you can drop off the call as you please. We will be recording the session, and it will be available to you on the NORC website, and we'll also send the slides and a link to the recording shortly after the webinar. As mentioned in the email that we sent to all registrants on Monday, it would be helpful if you have a copy of ACL's Table, NORS Table 2 in front of you while participating in today's dialogue. And there are links to the training materials in the chat box, which is on the side of your screen. Next slide, Katie. Today's agenda includes comments from ACL, a review of Part 2 training materials for the basic principles for complaint coding and ACL's Table 2, an open dialogue with questions from you all, and reminders of resources that are available through NORC. Next slide. If you have a question, you can submit it one or two ways. You can use the Q&A icon or the chat box. So if you take your mouse and scroll to the bottom of your screen, there's a black bar that should pop up, and it has a Q&A icon. You can click on that and submit your question, and then there's also a chat icon that comes up, and you can submit your question that way. So feel free to submit them either way, and we'll do our best to respond to as many as we can during the open dialogue. If we do not get to your questions today, we will do our best to reach out to you individually afterwards. And we may not have Louise. Oh, I do see Louise. Okay, great. All right, so now I'm going to go ahead and go to the next slide, Katie. And Louise, if you're on, I'll pass it over to you for a few remarks. Thank you so much. This is Louise Ryan, Ombudsman Program Specialist with ACL. And let me unmute.
Mute. Okay, can you hear me now?
I can, yes.
Okay,
thank
great.
you.
Well, good afternoon, everybody, and thank you for joining this call to kind of further deepen your knowledge of the new NORS codes, and so I really appreciate your giving this extra attention. I think today you're going to be, from what I understand, focusing on the complaint codes. And one thing I wanted to emphasize around the complaint codes is that we understand that at ACL, we understand that they're, with the new codes, you know, we purposefully reduce the number of complaint codes and combined codes. So we understand that that might mean that there will be less complaints next year, and that's okay. You know, that's part of what we're trying to do is not is to have the codes when they're collapsed. Maybe the numbers are fewer, but we can maybe make a more powerful message. And so I'll give an example. You know, I think last year there were maybe 500 complaints about laundry, and there was, and this I'm making up, but you know, 4,000 complaints about housekeeping, for example. But when they're all separated out, it doesn't sound as significant as when they're combined. So, to have a bigger number to describe issues from the federal perspective will be more helpful. Again, I know there's been some concern about, well, I'm really working on two different issues. It's laundry and it's housekeeping, but it's only one code. And we understand that, and we know that it might mean you're having to talk to multiple people to resolve both those issues. It doesn't diminish the work that you're doing at all, but we do need to kind of capture the data in a different way. And then I will also remind you that we will have to renew the NORS data collection. It expires in April 2021. So this is our opportunity to, once we get that first round of data, to kind of look at, well, is there something we really are missing? Maybe we were maybe we cut too many codes and we need a few more back in. So, this is our kind of test phase here where we're going through a pretty major overhaul. So, we will look to see what we might want to adapt in the next phase of NORS, and there won't be significant changes, but I see it as some fine-tuning that we can do in the next phase. Again, very modest, but fine-tuning to, kind of see if we missed something that we should put back in. So I just want to, reassure you that it's okay that your codes, that you are not trying to select two codes or select the same code twice. We don't want you to do that. It's one complaint code. It may have a couple of issues in there, but it's just one code. So with that, I will turn it back to Amity, and I will have to get off the call in a couple minutes to join another call. So sorry I can't stay on the whole time.
Thanks, Louise. Appreciate you joining for what you could. So thank you so much. Next slide, please, Katie. So you should be familiar with these documents. NORS training materials include a resource called Basic Principles, a quiz, and a quiz answer sheet. Part 2 does include a Beyond the Basics quiz and answer sheet as well. We're not going to spend a lot of time on those today on the Beyond the Basics, but if you do have questions about it, we can address them. Please note, if you didn't realize this already, that due to feedback on the materials after the 5-part webinar series we did earlier this year, an answer on the quiz was revised in September. Specifically, it was the answer to number 4 in the Section D, Autonomy, Choice, and Rights section. So please make sure you download and use the version of the quiz with September 2019 in the footnote. So just so you know, when you visit our website and you look at the NORS training materials, you'll see a little note next to them that says revised. And then you click on that and you'll be able to see the documents, and we even included notes about what specifically was revised, and then there'll be a date in the resource so you know you're using the most current version. We do not expect, I also want to be clear, we do not expect any other changes until the ACL charts expire in 2021. So just wanted to put that out there as well. But as Louise mentioned, this is going to be a learning process this first year. So if you see anything we're missing in our training materials or anything that doesn't make sense or that you think needs to be edited or added, feel free to send that to us. We are collecting that information internally in order to look at that in the future. Next slide, please. So this is a Basic Principles document. And as I said, each section or training part has one of these. And for the complaint coding basic principles, it reminds you that the term ombudsman is used as a generic term that may mean the state ombudsman, a representative of the office, or the ombudsman program. It was frankly just easier to do that throughout the training materials. So that note is in there just so you remember. Next slide. The Basic Principles document also reminds you that there are now 59 complaint codes, as Louise mentioned, and you need to choose the one code that best fits the problem. As I'm sure you'll hear in the dialogue later whenever we start responding to questions, there are times where you may not personally feel like it's the best fit, or that you're disappointed that one of the old codes was dropped completely. Maybe you used it more than others in your program or in the country, and there's not really a perfect fit in the new revised NORS codes. So just kind of keep the frame of reference that we're all just finding the one code that best fits the problem. So, and make sure to refer to the NORS Table 2, the Complaint Codes and Definitions document, because it has all of the complaint codes, examples, and reporting tips. Next slide. This document also provides a reminder that for allegations of abuse, gross neglect, or exploitation, you need to use code A. And NORS now requires that Ombudsman programs select a perpetrator code for the suspected perpetrator of abuse. This requirement is only for complaints about abuse, gross neglect, or exploitation, so it's only for code A complaints. Refer to NORS Table 1 for the definitions and perpetrator codes. And as a reminder, a perpetrator is the person who appears to have caused the abuse, gross neglect, or exploitation, and there could be multiple perpetrators for a complaint. Also, if the Ombudsman program and another agency, such as the State Survey Agency or APS, are both actively involved in a complaint investigation resolution, it still counts as an Ombudsman program case because the Ombudsman program is actively working it and doing work towards resolution. Next slide. These are links to two very important materials. The ACL Table 2, which as I mentioned has the complaint codes, definitions, examples, and reporting tips, and then also the Crosswalk B, which has the old NORS complaint codes and it walks them over to the revised codes. So you can see it's a really great document to connect those dots if you're having a hard time figuring out how to code something based on the old complaint codes. Next slide. And just as a reminder, we wanted to show you a snapshot of the ACL's Table 2. This is really just the top portion of it. But Table 2 reminds everyone that a complaint is defined as an expression of dissatisfaction or concern brought to or initiated by the Ombudsman program, which requires Ombudsman program investigation and resolution on behalf of one or more residents of a long-term care facility. We did include some arrows just to highlight some aspects of the table. In that black bar, you have the label, which is the name of the complaint. You have the code column, which is the actual complaint code. You have definition column for the definition of the complaint. And then you have something that's new to NORS materials, a column for examples and reporting tips. This column, as I mentioned earlier, really will be a great reference for you all as it provides additional details to the code label or name and definition by providing an actual example of how you would use that complaint, as well as some reporting tips. And that column was added to provide some more clarity between complaint codes to improve reporting consistency overall. Next slide, please. We created 2 new resources a few months ago and promoted them and rolled them out around the same time as the FAQ webinar that we had in September. But I wanted to call your attention to these. The one on the left is a 1-page document that only has the complaint codes and label or complaint name. There's nothing else, so it's just 1 page of those actual codes and the complaints. And then the second document on the right includes all of the complaint codes, definitions, examples, and reporting tips. It has all of the same information that you'd find in ACL's Table 2, but it's in a different layout that's similar to the structure of the complaint code resource from the previous NORS. So you may be more familiar with that layout instead of using a table. But we encourage you, especially as you're getting started in using the revised NORS, to refer to the core materials, which would be the ACL Table 2, until you're more familiar with the complaint codes, and then these are available as an additional reference. So now I'm going to turn it over to Maria, and she's going to review the complaint categories for us.
Hi, everybody. As Amity said, we're going to go through the 12 complaint code categories. We're not going to stay with them long, but we just want to have a reminder. Next slide, please, Katie. These are the A codes for abuse, gross neglect, and exploitation. There's 5 of them, if you'll remember. There's physical, sexual, psychological, and financial exploitation, and then gross neglect. And as Amity mentioned also, what's new this year is if there is an abuse and A code is used, you do have to identify who the suspect or the alleged perpetrator is. Next slide. So this is the B category, and you use the B category for when it's a complaint against the facility. And I believe there's 3 of those codes. They apply to access to information and records, language and communication barriers, and willful interference with the Ombudsman's work. Next slide. These are Category C codes, and those all deal with admission, the appeals process, discharge or eviction, roommate issues or room issues, choice in health care. Oh, I was slipping on into the D codes. Yeah, so there's the 4 there for Category C: admission, appeal process, discharge or eviction, and the room issues. Okay, now the next slide are for the D codes that deal with autonomy, choice, and rights. You might recognize the data, the code choices as choice in health care, living in a less restrictive setting, dignity and respect, privacy, response to complaints, retaliation, visitors, resident or family counsel, and other rights or preferences. Next slide, Katie. It's for the E categories, dealing with complaints involving facility staff, mismanagement of residents' funds, and property problems, personal property problems. Next slide. These are all the F codes. There's a lot of them. There's 12. Deals with accidents and falls, response to requests for assistance, care planning. I won't name them all, but there's, like I mentioned, 12 of them there. Next slide. This is the G codes for activities, community integration, and social services. So that's things like activities, transportation, conflict resolution, social services. Next slide is going to show us the H codes. There's 3 of them. It deals with therapeutic or special diets, dining and hydration, and food service. The next slide shows us the I categories. It's all about the environment, the physical environment of the facility. Could be anything from the environment to the building structure to supplies, accessibility, and the infamous housekeeping, laundry, and pest abatement. Okay, the next slide show us the H codes for facility policies, procedures, and practice. We will use this code for acts of commission or omission by facility leadership owners, including those administrators, the resident managers, or those in charge. It could be anything from staffing, fiscal management, or administrative oversight. Okay. Next slide are the K categories. These are complaints about an outside agency. So when you're doing work that involves decisions or policies or actions or inactions by the programs and agencies, it could be anything with dealing with regulatory systems, Medicaid, managed care, Medicaid, Veterans Affairs, and private insurance. Okay, the next category is L. This is systems issues that are not involved, the facility is not involved in whatever the complaint is. So it could be services from an outside provider, it could be something going on with the resident's representative or their family, they're having conflict with them. It could be a request for them to transition to community services. So I think, Katie, let's go to the next slide. I think we may have gone through all of the codes very quickly. I hope that you've got copies of them in front of you so that while we do the open dialogue, if you've got questions, you can refer to those codes. That would help us out. And I will turn the call over to Amity now.
Thanks, Maria. All right, everyone. So now is time for our open dialogue, and we'll be on as long as we have questions. And we did receive one by email, and I want to review the FAQs in just a moment. But next slide, Katie. I'd like to remind you all to just type your questions into the question and answer box, or using that Q&A icon at the bottom of your screen, or into the chat box. So to get us started, we received a question by email. Thank you so much. And if you're on the line and you hear your question, I know that you sent 2 questions, and I'm going to respond to one of those directly following the webinar to get more information. So the question was, in the previous NORS, there was a code P122 for legal or guardianship issues. And the crossover chart now says to use, that should be coded as L01 for resident, representative, or family conflict. And the person that wrote in said that that doesn't really fit the problem necessarily, because there isn't a conflict per se with the resident, representative, or family member, because there isn't a family member or a resident representative currently. It's an issue related to guardianship and other options. So I would say that I understand that this is one of those situations where we just have to go with the best fit. And I would stick with what the crosswalk says and use L01 for situations related to guardianship. And just so you know, on the call, the old code again was 122, legal, guardianship, conservatorship, power of attorney, or wills. And the crosswalk says to use L01, resident, representative, or family conflict. And the reason I say to stick with that one is because the examples and reporting tips says it includes complaints regarding resident decision-making, such as guardianship, conservatorship, durable power of attorney, wills, and similar complaints. So it doesn't necessarily mean there actually has to be a conflict with a family member or the resident representative and the resident. It just involves issues regarding decision-making. So it's kind of a bigger umbrella code. So I hope that answers your question, and that was a really good question. And like I said earlier, I think that you'll see those type of things as you start entering in your work. So while we're waiting for some other questions, I wanted to go over some FAQs that we have about complaint coding. You may have already become familiar with these, and if so, great. If not, I just wanted to highlight some of them because these are questions we get related to complaint codes. One of which was, when do you assign complaint codes? So for example, if a family member contacts your office with a concern and requests ombudsman action, do you code it after you've spoken with the resident to receive, the resident's consent to work that case and see if they share that concern? Or do you code it immediately? So the answer in the FAQs is to assign the complaint code upon receipt of the complaint based on the problem or problems identified by the complainant that initially contacted you. So if you are contacted by a family member with a complaint, the family member would be the complainant, and you'd assign a complaint code immediately based on those concerns. Then you speak with the resident for consent and to see if they agree with those concerns and how they want to take action on them, if at all. If the resident agrees with those concerns and gives you consent, and then shares additional concerns, then you could even open a separate case with the resident as the complainant and include those new complaint codes for those additional concerns. On the opposite end of the spectrum, if a family member calls you with a complaint, you document that complaint code based on what they share with you, and the family member is the complainant. You go out and visit the resident, and the resident does not agree with the family member and asks you not to proceed and not get involved, then you would close that case out as withdrawn or no action needed. So you still received a complaint as a program, and it might be a legitimate complaint, but obviously we are a resident-directed program and you're following the resident's direction, so you do not act. But you would still document that work and document that you received that complaint.
Which reminds me, Amity, recently someone asked me, really, do I have to document cases if I handled it the very same day? You know, that it was, I know it's not that way often that it happens, but you were there, you were able to handle it, they're done, I really don't want to do the paperwork. Yes, we want you to do the paperwork. So you would open the case, identify the complainant, what the complaint was, and that it was resolved on the same day, open and closed. So please remember to document your work. All of it's important, even if you get it done in one day or if it takes you 30 days.
Absolutely. Thank you, Maria. Great point. And I did receive a comment just adding to our response to the first question about complaint code 122 to complaint code LO1, just being specific that the complaint code says resident representative or family conflict, obviously stating that one or other or both could be the issue that falls under that complaint umbrella, which is very true. So thank you for that comment. So another question that we've received during our training on the revised NORS is that when a complainant has two complaints that would fall under the same code, do I only record the code once? So yes, record the code once as one complaint, yet you'd still work to resolve all the issues raised under that complaint code umbrella. So for example, if a complainant has two complaints that are under one code, which a good example of that, because a lot of codes were collapsed into this one, would be code I05, housekeeping, laundry, and pest abatement. The ombudsman would open, excuse me, that with one complaint. So it's just important to remember that you want to use one complainant per case and only one complaint code for each complaint. That's quite a mouthful, but that's part of the Part 2 training on, there's a good quiz question on the Beyond the Basics quiz and answer sheet about that. And kind of on a similar vein, we did receive questions about if there's a case where the complaint could be documented under two different complaint codes. Do I choose one code? Yes. This goes back to finding the best fit. Choose one code. Just try to use your best judgment in determining which complaint code to use if there's two very similar codes that could describe the complaint. However, if there are multiple distinctly different complaints, identify a code for each complaint. So I hope that makes sense and is helpful to some of you. And one last FAQ about complaint coding that we did receive during our training process is when is it appropriate to add another complaint to an existing case? versus establishing a new case. So this could be very state specific, so make sure you refer to your state ombudsman program policies and procedures or state ombudsman discretion or any kind of training that comes related to coding in your state, as your state may have a policy with criteria for when to open and close a case and when to consider adding more complaints into the open case. So if there isn't a policy or training or any kind of practice, then use your best judgment. For example, if a case is open, it hasn't been resolved yet, you're still working it, it's still active, and the complainant is the same person and the casework is ongoing, then you could add the new complaint to that current case. If the case was closed and it's still the same complainant, but they have a new complaint, then you'd open a new case. So, feel free to enter some questions. Or Maria, if you have anything you want to touch upon that I haven't, feel free to jump in. And we'll give a few more minutes for questions, and if we don't receive any, then we can go to the next few slides. Okay. So Katie, if you want to go to the next slide, and then if y'all have other questions that pop up while we're reviewing these slides, feel free to still add them to the Q&A or chat box. And if you think of any other questions as you're coding things, you can always reach out to us. This is definitely not the end of our technical assistance that we provide. Our TA is ongoing, so feel free to reach out to us individually if you please. So, just wanted to remind you, this landing page for NORS looks a little different than the previous NORS. So just wanted to remind you where it was. Now that we're using the revised NORS as of October 1, we archived all of the previous NORS pages, and so things look a little bit different on the website. So just wanted to remind you of where this is. We have a lot of information that we've developed that's available on this page. And as you can see, I circled the training materials towards the bottom of the page. And as I mentioned, it'll specifically say if something is new or revised. Next slide, please, Katie. And this is the page for frequently asked questions. I hope you were able to join our September webinar, but if you weren't, that webinar recording that reviewed all these FAQs is available on the website. As you can see on the left-hand side of the screen, the NORS FAQ and TA Open Dialogue webinars are all on the same page. There are 20 FAQs about NORS on this page, and then I circled the ones about complaint coding. You can just hit that link next to the bullet and jump right to that section of the page for the FAQs that you're looking for. And I also wanted to call your attention to the fact that the FAQs are available in a PDF version, so you can download it and carry it with you or use it during your training for volunteers or other representatives. And we are still, we plan on creating more FAQs, and it's of course based on your needs. So again, don't hesitate to reach out if you have questions or if you have suggestions for FAQs that you think would be helpful. Next slide. So just a reminder that you're obviously online today, so you've already registered for this webinar series. So you're already registered. You don't have to do anything else except join us again on December 17th from 3 to 4 Eastern Time, where we'll be discussing Part 3 and Part 4, closing the case and activities. The format will be very similar to today. I'd really recommend if you review the materials prior to the webinar so you can come with questions. And if you have questions before the webinar, feel free to email them to us ahead of time. That way we can have those ready to go for the open dialogue. If not, that's fine too. Please just join us on the 17th for the last one of these open dialogue webinars. Next slide. And like yes, Maria, go.
Hi, it's Maria. Before we close out, may I ask a question and see if we have people in the audience who can give me some feedback?
Absolutely.
I'm wondering, okay, so I'm wondering after we're 1 month and a half into Ombudsman using the new codes. For those who may have supervisory responsibilities or monitoring the volunteers' documentation of their work, what's been the biggest challenge? Like if you pull the data reports for the month of October to look at where the status is and you're reviewing the codes, has there been a challenge or a pattern that you have noticed? Okay, let's see. The biggest challenge for me has been technical. The reports haven't been there, and the reports that are there aren't acting correctly. Okay, that's good feedback. I don't think Amity or I, we can't address that today because different states are using different IT systems to collect the data. But I could see where that would be a challenge. And my question may have been too early in the process also because you've only had, well, 6 or 7 weeks of data entry. So I'm hopeful that those of you that are having some technical struggles will have the ability to pull those reports before long so that you can see how the coding is going for the staff.
Thanks, Maria, and thanks for sharing your experience, and I'm sorry to hear that. We have heard about issues with drawing down reports or them not being there or other issues with software, so sorry about that. And then we received another chat message. I'm seeing less time spent on activities. Oh, that's very interesting. So I assume you mean as far as coding activities like working with resident and family councils and providing information and assistance, those type of activities. So I'm curious to see how that's going to happen, how that'll be reflected long term after using it a little bit longer. So interesting. Thanks for sharing that.
And for the person who responded and said they've not been able to pull reports without the facility names and have been unable to do so, if you're a local ombudsman representative, I encourage you to let your state ombudsman know of what type of reports you would like to be able to see. I would think it would be helpful for the state ombudsman to know what the requests are and what the regional managers are requesting to see.
Thanks, Maria. I was going to say the same thing. Definitely communicate, and I'm sure you probably are already with your state office, and I know that must be incredibly frustrating. I will say on the plus side, though, I'm glad to see that so many people are trying to draw down reports and already looking at your data after entering it. So that's great work. So keep that up, and hopefully the software issues will be fixed soon. So continue. Unfortunately, as Maria said, we can't really help with the software end, but we do like to know what's going on. So if you are encountering issues like that and your state ombudsman is working on that, great. And we often hear from state ombudsman about what's going on with certain vendors in other states. So don't hesitate to reach out to us with anything related to NORS, and if we can't help you, we'll direct you to the right person. So here is our contact information. You have our phone and email. And then next slide, please, Katie, is also obviously our website and all of our social media things, as well as our app. If you haven't downloaded that yet, please do so. So with that, we'll wrap up a little bit early and give you time back in your day to go do the really important work that you do. So thank you all for being with us today. Thank you for Maria for presenting, and Louise for your remarks, and Katie for handling the back end of everything. Please keep us in the know with how things are rolling out in your states with the new NORS, and keep up the good work. There will be an evaluation for the webinar that pops up shortly, so if you could please complete that, we'd appreciate your feedback. So thank you very much. Have a great rest of your week. Bye.